Assalamu alaikum students. Today we will discuss inflammation and biochemical assessment, how inflammation affect on nutritional status, assessment for nutritional anemias, type of anemia, and difference between nutritional anemias and non-nutritional anemias. Um, uh, Markers of inflammation. In our previous lecture, we have discussed hematological assessment of the hydration status. Inflammation. Inflammation is a vital part or key part of the immune system that responds to injury and infection in acute illness or during chronic or in case of physical stress. Inflammatory conditions or inflammatory responses trigger the immune responses to release the cytokines that mobilize the nutrient required to synthesis and there are increases during inflammation in which TNF, cytokines, interleukin, and IL-1 beta and so on influences whole body metabolism, body composition, and nutritional status. Inflammation affect the body composition, nutritional status, and metabolism. So these are the effect on three main: body composition, metabolism, and nutrition status. And protein, plasma protein, synthesis of plasma protein, and increases the breakdown of muscle protein. Breakdown of the muscle protein to meet the energy needs. And edema also occur during infection or inflammation because albumin is transferred to the interstitial compartment. Due to this reason, edema is occur. Negative acute phase reactant that are we have already discussed in our previous lectures. During inflammation, decrease the value of negative acute phase reactants, including albumin, prealbumin, transferrin, and it reflects the basically severity of the tissue in acute when initially inflammation start or in earlier stage. Negative acute phase reactant value do not reflect current dietary intake or protein status. During earlier phase, these reactants or negative acute phase reactant does not reflect any change or any indicator or prediction of the nutritional status or protein intake. During inflammation, anemia is also present or because the production of the erythrocyte or inhibit the synthesis during the infection. IL-1 inhibit the production or release of the transferrin while stimulating the synthesis of ferritin. So due to this whole, the anemia is occur and the laboratory test result used to predict the risk of nutritional anemia. And During inflammation, the negative acute phase reactant decreased and positive acute phase reactant increased. And in negative acute phase, albumin, transferrin, retinol binding protein, and prealbumin. And in positive acute phase reactant, C reactive protein, C3, C4, and ferritin, fibrinogen, hepatoglobin, serum amyloid A. Nutritional assessment for nutritional anemias. Reduction in the number of erythrocytes per unit of blood volume or increase in Hb of blood to below the level of usual physiological needs is called anemia. And anemia is not a disease, symptom of other conditions or various disease including excessive blood loss and blood cell destruction, decrease the blood cell formation. Nutritional deficiencies. The nutritional assessment for nutritional anemias and nutritional deficiencies are very important cause of low level of the HB or the erythrocyte production. And the when we said the anemia associated with mean RBC volume, the unit we consider the femtoliter, and when anemia associated with RBC volume is less than 80 is called microcytic, and if value is between 80 to 89 then normocytic, and if value is greater than 100 or 100 macrocytic anemia. And in microcytic anemia is linked with iron deficiencies where macrocytic due to B12 or folate deficiencies, or other tests also done to identify either nutritional anemia or non-nutritional anemia, causes of anemia, anemia due to any diseases like thalassemia or renal diseases, and in case of normocytic anemia is linked with inflammation, infection, any injury, fracture, cancer, or heart diseases. CBC is very helpful to identify the non-nutritional causes of anemia, including leukocyte and reticulocyte, and when in case of bone marrow failures, the level of these are low, and in case of infection or leukemia, level are increases when not symptoms are non specific or No, the picture about any disease is not clear, then erythrocyte sedimentation rate is very helpful. And when RBC production rate is increases, the rate of the reticulocyte is also increases. That maybe increases the chances of bleeding. Hemolytic anemia. Basically, in hemolytic anemia, the red blood cell destroy, and the breakdown of the red blood cell is hemolysis, or the destruction of the red blood cell is called hemolysis. The rate of the breakdown or the destruction or the destroy rate is faster than MAID. And in hemolytic anemia, the RBC size may be normal, still remain normal. And normocytic anemia, or in microcytic anemia, caused by the chronic and acute blood loss, either by any injury or any surgery. And during macrocytic anemia, folate deficiency, vitamin B12 deficiency. So when in case of the macrocytic anemia, we evaluate or check the level of both vitamins. Markers of the iron deficiency anemia. These are the markers of the iron deficiency anemia. Some of the markers we have already discussed in our previous lecture, and remaining of the markers we will discuss in our next lecture, inshallah.